Thank you, Sherry, for the kind introduction. Good afternoon, friends and colleagues. Today, Dr. Tang and I are going to share with you on retinal peel. We have no disclosure to declare except that this afternoon session is by the courtesy of Neo Asia. We will try to cover the following topics: definition and indication of chemical peel, absolute and relative contraindication for chemical peel, what are the type of peels and their indication. We will introduce new strata pro system retinal peel, how to do patient selection and assessment, how to perform retinal peel, followed by a listing of the possible skin effect and side effect of chemical peeling. Then we will end with some take-home messages. Over the century, various techniques have been employed to reverse skin changes caused by photoaging and many cutaneous dermatosis. Among these methods, chemical peeling has withstood the test of time. What is chemical peeling or chemoexfoliation? This is a method where chemical ablative agent is applied to the skin surface in order to induce keratolysis or keratocoagulation. This causes a rapid, predictable, and uniform thickness destruction to all or part of the epidermis or dermis, leading to exfoliation of these layers. After the wounding process, regeneration and remodeling of the epidermis and dermis will occur and ultimately results in improvement of the appearance and the texture of the treated skin. When do we do chemical peeling? Chemical peel is useful in the treatment of pigmentary disorder like lentiginous, melasma, and post-inflammatory hyperpigmentation. It can be used in inflammatory dermatosis like acne vulgaris, acne cosmetica, or comedonal acne. Chemical peel also can help in reducing scarring caused by acne, trauma, or surgery, and it can help to reduce the effect of photoaging and photo damage. Chemical peel also can be used in treatment of epidermal proliferation or pre-malignant skin lesion like actinic keratosis. What are the absolute contraindications for chemical peel? Obviously, if the patient has a history of allergy to any of the chemical peel ingredient, it shouldn't be done in pregnant or nursing mother. It shouldn't also be done in patient with active infection or wound or open wound. Patients who are taking oral isotretinoin within the last 6 months is also contraindicated, but this is more relevant for patient who's undergoing medium or deep chemical peeling. Patient with dark skin type like Fitzpatrick skin type 5 and 6 should be used in caution, and also patient with unrealistic expectation. What are the relative contraindication? Questionable patient compliance, patient who need to have regular and intense sun exposure, patient who are a heavy smoker, history of previous or recent herpes simplex infection. If a recent infection, chemical peel should be done after 4 to 6 weeks of healing process, and in this instance, they would need antiviral prophylaxis. History of hypertrophic scar and keloids is also a relative contraindication. Patient with multiple comorbidity morbidity, as this will increase risk of toxicity, delay wound healing, and also increase risk of infection. Concomitant dermatological conditions, especially lesion on the face, doing a peel can aggravate this condition. Previous or current medication, especially those taking photosensitizing or hormonal drugs. Those patients who have undergone aesthetic procedure, we need to actually time the interval from this procedure before we embark to doing a chemical peel for them. These are the Fitzpatrick skin phototypes. Our Asians are basically within type 3 to type 6. To talk to us on the type of chemical peel, I will pass over this session to Dr. Tang.
Thank you, Dr. Chan. Now let's look at what are the types of chemical peels available. Chemical peel can be divided based on the depth of penetration of the chemical agent. In general, there are 4 classes of chemical peel. The first is very superficial chemical peel. Example of chemical agents grouped under this category are glycolic acid 10 to 30%. Glycolic acid is also a form of alpha hydroxy acid. Apart from that, salicylic acid 20 to 30%, Jasner solution 1 to 3 cups, tretinoin or retinoic acid 1 to 5%, and trichloroacidic acid 10 to 20% are all considered very superficial peel. Very superficial peel basically penetrate only up to the stratum corneum of the epidermis. The second group will be superficial chemical peel. Example of superficial chemical peel include glycolic acid 50 to 70%, Jasner solution 4 to 7 cups, tretinoin or retinoic acid 10%, and trichloroacidic acid 20 to 30%. Superficial chemical peel will penetrate the entire epidermis up to the basal layer. And the third group will be medium depth peel. Example of chemical agents that group under this category are trichloroacidic acid 35 to 50%, glycolic acid 70% plus trichloroacidic acid 35%, and Jasner solution plus trichloroacidic acid 35%. Medium depth peel will penetrate up to the upper reticular dermis. And the last group will be deep depth peel. The classical example is Baker-Gordon phenol peel, which will penetrate up to the mid-reticular dermis. Jasner solution is a special solution that consists of 14 gram rasosinol, 14 gram salicylic acid, 14 gram lactic acid, and ethanol to make up 100 ml. This diagram illustrates the depth of chemical peel penetration as what I have mentioned just now in the table. As you can see here in this diagram, very superficial peel only penetrates up to the stratum corneum, whereas superficial peel penetrates up to the 60 micromilliliter of the skin, which is entire epidermis. And medium depth peel will penetrate up to the upper reticular dermis, which is around 450 micromilliliter. And that deep depth peel will penetrate up to the mid-reticular dermis, which is around 600 micromilliliter. Sometimes we can combine several types of chemical peeling agent to enhance the depth of peel without using a higher concentration of a particular peeling agent. The example are Monhel peel, which consists of Jasner solution and 35% trichloroacidic acid. Coleman's peel, which consists of glycolic acid 70% and trichloroacidic acid 35%. In darker skin, this common peel can use lower concentration of trichloroacidic acid consisting of 10 to 25%. And Brody peel will be a combination of solid carbon dioxide dry ice with 35% of trichloroacidic acid. Now let's look at what are the indications of chemical peeling based on the depth of peel penetration. For superficial peel, it can be used to treat acne vulgaris, mainly for comedolytic effect. Apart from that, superficial peel is also indicated for actinic keratosis, solar lentiginous, melasma, flat seborrheic keratosis, and superficial skin retexturization. Superficial peel is the commonest peel done by most of the clinicians, and it may be used on all fixed-patrick skin types because it has an excellent safety records. It has rapid healing process with minimal downtime, and it can be repeated to provide cumulative effects, and there is no anesthesia required. On the other hand, medium depth peel can also be used to treat the similar indication as in a superficial peel. However, it can be used for more severe cases. And medium peel can also be used to treat wrinkle. Nevertheless, medium depth peel require special training, and hence it can only be performed by trained personnel. And it can be painful and associated with intense burning. And therefore, it may require local anesthesia. And it should only be done with great care in darker skin patient with skin Fitzpatrick type of 4 to 5 because of higher risk of post-inflammatory hyperpigmentation. Deep depth peel is indicated mainly for deep wrinkle, acne scar, and skin laxity improvement. And deep depth peel technically is more challenging and it requires anesthesia. And the chemical agent phenol, which is used in deep depth peel, may cause cardiac toxicity. And this deep depth peel is not recommended for dark skin patients because of very high risk of post-inflammatory hyperpigmentation and scarring. And currently, deep depth peel is less favorable, and it has been largely replaced with laser, which has improved control of ablative depth and relative lack of systemic toxicity or side effect as compared to deep depth peel. Well, the choice of the types of peel can be guided by degree of photoaging in our patient's skin. There are several photoaging classifications available in the literature. Examples are Chong photoaging classification, Glogau photo damage classification scale. In general, medium or deep peel may be required for more advanced photoage skin.
At this point, we would like to introduce Neostrata Pro System Retinol Peel. The main constituents of this peel is retinol, which this is a high potency peeling agent. Retinol is a precursor to retinoic acid. It gives a better tolerance. It can also increase epidermal thickness and reduce MMP activity or the collagenase activity, therefore enhancing collagen production. The Pro System Retinol Peel is also incorporated with unique patented retinol boosting complex, which consists of neocitrate, aminophil, and bisoprolol. Neocitrate is a firming agent. It enhances collagen, plumps up matrix to give a lift and firming of the skin. Aminophil is a volumizing agent. It also target collagen and hyaluronic acid to give the plumbing and firming effect of the skin. Bisoprolol is derived from chamomile. It acts as a soothing or calming agent. Pro System Retinol Peel is also contain vitamin E as a protectant due to its antioxidant and free radicals scavenger property. The vehicle for this peel is alcohol solution. It contains photostabilizer to protect the retinol, and it is preservative, fragrant, and oil-free. What are the main benefits of Pro System Retinol Peel? It reduces appearance of fine line and wrinkles, improve motile pigmentation and pore size. It can also improve skin laxity. It enhances clarity of the radiance of the skin. It can increase smoothness of uneven or rough skin texture. It reduces acne and gives a visual softening of the acne scars. How do we do patient selection and assessment? These are the checklist for patient selection and assessment. Firstly, we need to get the right indication, explore the patient occupation, lifestyle, and hobbies, mainly in regard to the degree of UV exposure. Ask for their associated comorbidities. any history of recent or previous resurfacing procedure, recent or previous history of herpes simplex infection, any photosensitivity, any abnormal hypertrophy or keloid scars. We also need to explore the concomitant medical dermatological condition and also on previous or current medication like isotretinoin or photosensitizing drugs. For women of childbearing potential, inquire about pregnancy and breastfeeding status. In the examination, mainly is to note what is the Fitzpatrick phototype of the patient for us to choose the appropriate pill. Superficial chemical peel like retinol peel are basically suitable for almost all the skin types. We need to take an informed consent and if possible, do a baseline photography as for comparison.
Now let's look at how to perform retinol peel. These slides summarize the 6 essential steps involved in retinol peel. First is cleansing, followed by pre-peel preparation, and third is peel application, and then monitoring and peel completion, and finally post-peel skincare. Let us go through each steps. Step 1 is cleansing. We need to clean the skin with facial cleanser to remove makeups, oil, and surface debris, and then rinse thoroughly with water. This is then followed by pre-peel preparation. We may choose to use Pro System Balancing Pre-Peel Cleanser to prepare the skin for the peel and to bring the skin to a uniform pH. However, do not rinse after application of pre-peel cleanser. And then we need to lightly apply petrolatum with cotton dip applicator to both inner and outer corner of eye, lower and upper lips lines, and other areas of potential sensitivity or where the peel solution may pool to protect this area. After that, we have to protect the eye area by advising the patient to keep eyes closed throughout the procedure or cover the eyes with protective eye pads. This is then followed by peel application. First, we remove one Pro System retinol peel unit dose vial and then remove the plastic top and tear back the attached metal collar and finally remove the rubber stopper. Pour the entire contents of Pro System retinol peel into a dispensing cup and then apply uniformly to the skin with a fan brush. We may apply a single layer for a lighter peeling effect and multiple layers for a stronger peeling effect. After that, we need to monitor the skin for approximately 10 minutes. We need to observe for sign of erythema and ask the patient for any discomfort. If the skin experiences severe erythema or discomfort, we may rinse off the peel immediately. Upon completion of peel application, we do not remove the peel, but we may apply sunscreen as tolerated. Gently pat on the sunscreen without rubbing the skin. For retinol peel, neutralization is not required. After that, we need to instruct the patient to wash off the peel after 8 hours or overnight when they reach home. And the peel can be washed off sooner if irritation develops. For those with sensitive skin, where a lighter peeling effect is desired, they can actually wash off the peel after 3 hours. And after washing, they need to apply moisturizer and reapply it regularly. It is important for us to provide post-peel skincare instruction to our patients clearly. We need to instruct our patient not to pick, peel, scrape, or scratch the skin. And they are not allowed to use exfoliating products within the first 1 week after the chemical peel, and do not wear tight headbands, hats, and avoid sun exposure, and always use sunscreen when outdoors during the day, and apply moisturizer regularly during the period of skin peeling until the skin returns to normal before commencing their own facial product. Now I would like to show a video on retinol peel demo session. Well, this table summarized the 6 essential steps involved in performing retinol peel, as what I have mentioned just now.
So what are the post-peel skin effect and the possible side effect? The patient may experience skin tightness or dryness during the first 2 days. Visible flaking and peeling will usually begin on the 3rd day and continue for approximately 1 week post-peel. The improvement of the overall photo damage can be seen as early as after 1 peel, but the accumulative effects of repeated peels give a more desirable results. Usually, we will plan the next peel by after 6 or 8 weeks. Retinol peel is generally safe and have minimal side effect. Some patients, however, may experience intense erythema, stinging, itching, peeling, and mild edema of the skin. This side effect will gradually diminish over time with just moisturizer application. However, if prolonged or severe, low-potency topical corticosteroid may be used. Chemical peel sometimes may cause perioral dermatitis, acne flare, herpes simplex flare, hyper or hypopigmentation. Hyperpigmentation can be treated with a skin lightening product. Hypopigmentation may take longer to resolve. This is a study conducted by Dr. Neil Sadiq from New Strata, New York, and the study is published in the Journal of Drugs in Dermatology in the September 2019 issue. The objective of the study is to evaluate the tolerability, safety, and efficacy of ProSystem 3% retinol peel with a supportive home care. These are the agent used as a home care. They recruited about 24 female patients aged between 18 to 65 years, and they categorized them into 4 main categories: the photo-damaged skin, the acne group, the hyperpigmentation of the melasma group and the skin of color group, which include Fitzpatrick skin type 4 to 6. They all undergo a series of 2 to 4 pills with a 6-week interval. A total of 78 pills were done. Dermatologist grading, self-assessment, and digital photography were documented to assess the tolerability and the efficacy parameters. So these are the results. In the photo damage group, the overall photo damage effect was significantly improved after 1 pill. Fine lines and pores were significantly improved after 3 pills, and all the parameters were significantly improved after 5 pills, as shown in this graph. A photo showing one of the patients from the photo damage group. After 2 pills, she obtained a smoother forehead lines and more even skin tone. For the photo damage parameters were also decreased throughout the series of pill in the melasma group and in the skin of color groups. In the skin of color group is just after 2 pills. And also in the acne group, there are noted improvement of acne changes even after the first pill. This improvement continue after subsequent pills. This photo shows one of the patient from the skin of color group. There's noted to have improvement in hyperpigmentation on the forehead and the over clarity just after 2 pills. This patient is from the acne group. You can see the improvement of acne, the skin texture, and diminished impigmentation after 2 pills. Whereas in the melasma group, the improvement of melasma along the jawline and the overall skin texture were seen after 3 pills. In conclusion of this study, the 3% retinol superficial pill was well tolerated and efficacious, and is an efficacious cosmetic treatment, but this is conducted under the physician's supervision to all skin type in order to and they result in firmer skin, improved fine lines and wrinkles, and they also have promote a bright, even complexion. So in the take-home messages, retinol pill is a superficial chemical pill that is well tolerated in all skin type and is easy to be carried out. It is a useful, non-invasive cosmetic treatment for hyperpigmentation, melasma, acne, and effect of skin aging and photo damage. Good patient selection and proper counseling of patients on the pre and post-pill care is important to ensure optimal outcome and minimizing the side effect. With this, we thank you and we welcome any questions. Thank you.
Thank you so much for Dr. Chan and Dr. Tang presentation just now. So now we are now open to questions. So I think there are some questions in the Q&A session ready. Okay, let me open the questions. Okay, let's see the first one. There's someone asking, so far Dr. Tang and Dr. Chan, in your practice when using this retinol pill, how is the patient satisfaction like, and generally how many pills would we need to conduct to see a very significant results? Probably I pass this question to Dr. Chan first, then if anything that Dr. Tang want to add on, then Dr. Tang just open your mic and talk about it. So Dr. Chan, please.
In my practice, most of the time I do retinol pill for patients with acne or those completed treatment with isotretinoin. They still have some few pop up, like especially comedonal lesion. I have patient who says that after one peel, they like it. They feel the skin are smoother, and then subsequently, after 3 to 4 peels, you can see more desirable results. They are quite happy after like 3 to 4 peels.
That means it is around 3 to 4 pills. Okay. So how about Dr. Tang? How about your patient there? I think Dr. Tang has some technical issue. Yeah, I can hear you. Yes,
Can you hear me now?
Yes, can hear you clear.
Okay, I have similar experience as Dr. Chan. I use retinal peel mainly for acne vulgaris patient, especially those complicated with acne scar, PIH scar. So it actually works quite well on this group of patients. And my practice is usually 6 weekly for about 3 sessions. And most of my patients are very satisfied with this treatment. And, you know, I can actually see a quite significant improvement after 3 sessions, especially in terms of the post-inflammatory hyperpigmentation.
Okay, so it is around 3 sessions. It's quite fast. Yeah. We can see a result. Yeah. Actually, I personally have a question regarding
and
this.
And there are
also.
some patients who will continue, you know, doing it. Yeah.
Okay, so actually, for me, I have some questions.
Some may choose to continue, especially those who are quite happy with the treatment. Sorry, I think my internet is.
It's okay, doctor.
Slow, so there is a delay. Yeah, it's okay.
Then can I just address my question to you? Okay. So actually, in our I have some questions just now. It's like Dr. Tang was mentioned, like he actually used this retinol pill. It is mainly for acne vulgaris and also for PIH. So how about Dr. Chan? Do you actually how do you identify which kind of patient they are suitable to use, maybe glycolic or maybe retinol? How do you identify which patient to use which kind of pill actually?
Okay, usually we will prefer retinol peel because it's simple and very quick. You can do the procedure and it doesn't need neutralization. Usually, patients who can tolerate retin A or retinol application, I will actually usually recommend them retinol peel. Unless those patients who tell me they can't even use topical adapalene or retin A, a lot of peeling, then my choice usually I will choose glycolic peel. And then for darker skin patient, I actually prefer glycolic peel to retinol peel, but mainly worry about the PIH, the side effect of PIH.
Okay.
Yeah, basically that.
Okay, understand. So I think for Dr. Tang just now also mentioned he is using this for acne vulgaris and also for PIH more. So I think this should be Dr. Tang answer for my question, right?
Yes.
Yeah. Okay, so now let's move to the next question. So, okay, there are someone asking, should topical retinoid derivative like adapalene should be stopped at least 1 week before a chemical peel? How fast can we resume using the topical retinol after the chemical peel? Yeah, Dr. Chan, do you have any things to answer about this question?
I usually ask them to stop either 5 to 7 days before I actually plan the pill when they give appointment and tell them to stop adapalene 5 to 7 days before the pills. And
5 to 7 days.
And then they can restart back the treatment when all the skin have re-epithelialized. There's no more peeling effect. Then they can start to apply their adapalene. Yeah.
Okay. So that means it is 5 to 7 days before the peel. And then after the peel, when we don't have any peeling effect, then we can start using back the retinol topical derivatives. Okay. I think Dr. Tang, your answer should be the same with Dr. Chan.
Yeah, that's right. Yeah, so basically, I will choose my patient who can tolerate adapalene or tretinoin prior to that before I subject them for the retinal peel. So sometimes you can do priming to see whether your patient can tolerate retinal peel or not. So that treatment can be continued around 2 to 4 weeks prior to the retinal peel and stop about 5 days to 1 week, as what Dr. Chan mentioned, before you subject them for the retinal peel.
So that's when we can do a trial on their skin first.
Right.
Okay, understand. Thank you, Dr. Tang. So the next question is, okay, with the usage of this pill, do you put your patient on laser treatment too? Maybe I address this question to Dr. Tang first. Let Dr. Tang answer about this question.
No. So, sorry, I don't combine chemical peel with laser at the same time.
Laser at the
Yeah, can you hear me?
Yeah, can. Yes, now can.
I don't combine chemical peel with laser. So because it will increase the risk of PIH, especially post laser. So of course you can do it after the laser treatment is completed, right? But not immediately after the laser.
Okay, that means we can do the chemical peel with laser, but actually in your practice you are not really recommending on this kind of treatments. But if they if they want to, they can do it like after
Definitely
healing.
That's right, after healing. Yep.
Understand. So for Dr. Chan, how about your practice on this laser and peel together?
Yeah, I think I have the same opinion with
Dr. Tang. Okay, thank you. And there is another question. Can this Neostrata retinol peel be used in a combination therapy with drugs-based treatments like hydroquinone or tretinoin creams to treat melasma? Maybe I address to Dr. Tang also for this time, because just now Dr. Chan has answered too.
Yeah. So yes, I do combine physical therapy like chemical peel on top of topical agent in treating melasma patient. So normally I will start with, depending on the severity of the melasma. If very severe, I generally tend to start on triple combination therapy to bring down the disease severity. And if let's say the response is still not too good, then I will add on other treatment, including oral tranexamic acid, depending on the underlying risk factor of the particular patient. So bear in mind, tranexamic acid may increase the risk of thrombus formation. So it's a pro-coagulant agent. So you have to be very careful in patients with underlying risk factor. And for those who can't take tranexamic acid orally, then I may consider to put them on chemical peeling. So retinol peel is one of my favorite choice. As what Dr. Chan has mentioned just now, it is pretty safe and quite simple to do. That's the most important key. Very simple to do as compared to some other chemical peel. So I will definitely choose retinol peel as one of my options in helping the patient with resistant melasma that do not respond to topical agent.
Okay, understand. Then how about Dr. Chan practice on this drug-based treatments?
Yeah, actually, in some cases, especially darker skin patient, I think hydroquinone and retinol cream can also be used as a priming agent, a pre-pill where you give them, ask them to use about 2 to 4 weeks before you embark to do your retinol peel. And of course, it can be combined with retinol peel in the treatment of melasma. As Dr. mentioned just now, either you use your you can use your hydroquinone or tretinoid cream, and usually these are in the triple fixed combination for melasma treatment. And also, like Dr. Tang mentioned, he used either oral, and also now there's also availability of topical tranexamic acid. So actually, you can actually combine. As you know, treatment of melasma by itself is already very challenging.
Understand. So actually, all of this like oral, like tranexamic acid oral and the drug-based treatments like the hydroquinone, actually, yes, we can combine. Just that we need to under a doctor supervision. It is very close supervision with a doctors, lah. I think it is a yes from you, both of you. I think, but we need to examine it very closely. Okay. There is one question in the chat. So there's one person asking if doing chemical peel for acne patient, do we still need to continue using the topical acne gel or the oral antibiotic? So I will address this question to Dr. Chan. How is it your opinion on this question?
We actually can continue using that, like the anti-acne cream you are referring to, probably the retinoids, the adapalene, yes. And I usually ask them to restart back after all the peeling, the reapplication have occurred. And I think the question is can we combine them, right?
Yes, combine with the topical acne gel or oral antibiotic for acne.
Yeah, of course, when the reapplication have occurred, and because during that period, we encourage them to use a lot of moisturizer, and all this peeling or exfoliative agent, we have to defer until the peeling have resolved.
Okay, understand. How about Dr. Tang? So you are doing the same practice, right?
Yes, like what Dr. Chan mentioned, actually you can continue the topical acne gel, but probably during the peeling effect, during the period when the peeling is taking place, try to avoid the irritating cream like differing or tretinoin for a while, usually for about 1 week. And after that, when the peeling has completely resolved, then you can resume your topical acne gel.
Okay.
And the oral antibiotic, as what asked by this participant, yes, you can actually continue the oral antibiotics concurrently if the patient is still on the active treatment. But generally, most of the time, I would choose to do chemical peeling when their acne is a little bit more stable. Right?
Okay. So actually for this, a lot of topical things like tretinoin or topical acne gel, both of you are recommending patient to use it back after the skin heal, right?
Yes.
Yes. Understand, because the skin is not really healing. Then if we add on some other things, it might causing some side effects. Okay, understand. So the next question, okay, they are asking for back acne. So do you have any practice that you're using retinol peel for back acne? So I think Dr. Tang, please.
I have not used retinol peel for truncal acne yet. Truncal acne, a lot of time, my choice of treatment is actually systemic agent. Yeah, because it's easier actually to control very extensive acne over a big area. And because retinol peel, the amount in one vial is only 1.5 ml. So I'm afraid it may not be adequate to apply over the whole back area. So it may not be very effective if you just use one vial. And if you need to use more than one vial, then the cost is actually another big concern. So under that circumstances, then I would rather choose oral medication, and probably together with some topical application, if they can use topical agent at night, by asking one of the family members to apply on it. Basically, if you ask them to apply the cream on their own, it's really difficult because they can't see it. So most of the patient will not be compliant to topical agent. So the oral medication will be the best choice, right?
Okay, understand. How about Dr. Chan, also using the oral medication?
Yeah, agreed. Basically, we start oral medication, and also you can actually ask patient to get some wash. This is more cost effective, like wash containing salicylic acid or benzoyl peroxide wash, and continue the topical cream that they apply, like Dr. Tan say, you need somebody to help you to apply. But if you look at the literature for back acne, the recommended choice is salicylic acid peel, because they can remove the block comedone better. So, and also I agree totally, the cost effectiveness, because the amount is small to apply the whole back won't be cost effective.
Yeah, I think for bad acne, if we use the retinol peel, I think not only 2 vials is needed. I think it's 3 to 4. Then the cost is very high for them then. Okay, thank you, both of you. Okay, the next question is, they are praising your skin. Doctors, your skin are very nice and glows. Do you use your peel on your own face? So I think I address this question to Dr. Chan first. Yeah, because your skin are glowing. It's glowing today. And do you use it?
Unfortunately, my skin cannot even tolerate adapalene because it peels very badly. So unfortunately, I don't have the privilege to use anti-aging or
Regimen.
for acne. I can't even use that. So I tend to use things like resorcinol or salicylate for myself.
Understand. How about Dr. Tang? Do you use peel?
Yeah, I use retinol peel on myself.
Oh,
And
is it?
yeah,
I'm so happy
use
to
it
know that.
on myself as well. Yeah, I pretty very quite satisfied with the results. Yeah.
Yeah, actually it is glowing after using it, and sometimes it's plumping your skin texture also.
Yeah.
Okay, I think that's all question that we have asked. And then do you have anything to add on, Dr. Chang and Dr. Tang?
Happy using retinol peel.
Thank you so much to be a loyal fans of retinol peel. So I think that's all for today's session. Thank you, Dr. Chan and Dr. Tang, for the lecturing session just now. It's very fruitful. And thank you for everybody for spending your weekend with us. And hope to see you again in next webinar or even physical event after the pandemic. So stay safe and goodbye, everybody. Thanks.
Bye-bye.
Bye.